As we grow from childhood to adulthood, we live our lives enjoying school, parties, and social events without ever expecting the onset of a disorder called scoliosis. Scoliosis is an abnormal curvature, and rotation of the spine, usually creating an S or C shape. It is normal for a spine to have a slight curve. However, if the curvature is greater than 10 degrees, it is called scoliosis. Here is a picture of the normal spine on the bottom versus a spine with scoliosis seen on the top. There are 4 different causes of scoliosis, and these are congenital, neuromuscular, degenerative, and idiopathic. Congenital scoliosis is caused by bone abnormality from the time of birth. Neuromuscular scoliosis is a result of abnormal muscles on nerves seen in those who have spina bifida or cerebral palsy. Degenerative scoliosis is a result of traumatic bone collapse, major back surgery, or osteoporosis. Idiopathic scoliosis is the most common type, and there is no specific cause. National Health Services states in 80% of cases, there is no known cause. It is idiopathic. Idiopathic scoliosis is usually inherited. National Institutes of Health states of every 1,000 children, 3 to 5 develop spinal curves that are considered large enough to need treatment. Adolescent idiopathic scoliosis is the most common type and occurs after the age of 10. Girls are more likely than boys to have this type of scoliosis. Because scoliosis can run in families, a child who has a parent, brother, or sister with idiopathic scoliosis should be checked regularly for scoliosis by the family doctor. I was diagnosed with scoliosis at the age of 19. Having scoliosis has made me want to research more about it. My intent of this speech is to inform my audience of the signs and symptoms, treatment options, and coping mechanisms to deal with scoliosis. The first thing parents and caregivers need to recognize are the signs and symptoms of scoliosis. The signs and symptoms range from mild to severe, but affect every person differently. There are different signs and tests performed to determine whether or not someone has scoliosis. The first way to diagnose scoliosis is through a physical examination. The doctor performs this exam by looking at the patient's back, chest, pelvis, legs, feet, and skin. The doctor views the patient's shoulders to see if they are level to one another, the head to see if it is centered, and the opposite sides of the body to see if they are level. Another way to diagnose scoliosis is through X-rays or MRI. These images will confirm the diagnosis of scoliosis. Through these images, the doctor can measure the angle of the curve and exactly where the curve is located. Symptoms of scoliosis vary from person to person. Scoliosis can affect a person's quality of life. The authors of Relay Clinical Education address many of the symptoms of scoliosis. Some specific symptoms are increased cause of pain, reduce of lung function, problems with heart function, lower back pain, uneven hips or shoulders, change of posture, leaning more to one side than another, uneven leg lengths, and tiredness after sitting or standing for a long amount of time. Having scoliosis can also cause some psychological problems. Now that we have learned about the signs and symptoms of scoliosis and how it is diagnosed, we will move into what treatment options there are for those with this disorder. There are different types of treatment for those who have scoliosis. Most children with this disorder do not need treatment with a brace or surgery because it is not too severe. When a doctor is deciding the treatment options for each patient, he or she takes into consideration the gender, severity of the curve, and the location of the curve of bone maturity. Females have a higher chance of their scoliosis worsening than males. If a child has an S-shaped curve or a double curve, or if the curve is located in the middle of the spine rather than the top or the bottom, they also have a greater risk of scoliosis worsening over time. If a person's bones have stopped growing, then the curve progressing is lower. One option of treatment is casting. This is a plaster cast that the child cannot remove on his or her own. This only happens in the early cases of scoliosis. This casting is changed often because of how fast the child grows. Another option for treatment is a brace. Braces can prevent further curvature, but will not cure or reverse the curve. The two types of braces are the thoracolumbosacral orthosis and the Milwaukee brace. The thoracolumbosacral orthosis is a brace that fits the body underneath the arms, around the rib cage, lower back, and hips to fit like a corset. The Milwaukee brace is a full torso brace that also supports the chin and the back of the head with a neck ring. The last option of treatment is surgery. The authors of The Human Body in Health and Disease say that the surgical procedures straighten the spine can involve bone grafts and the insertion of internal metal rods. This surgery helps reduce the spinal curvature and prevention further curvature of the spine. After the child has the surgery, it can take anywhere from a few months to a year to go back to normal activities. Physical therapy is also helpful for a person with scoliosis. Physical therapy will not fix the spine, but it can help from preventing further damage to the spine. Scoliosis can have a very big impact on someone's life. Now you will hear of different ways to cope with this disorder. Having scoliosis can affect a child's life. Some children are teased by their peers because they wear a back brace or have to have surgery. U.S. National Liberty of Medicine tells people about support groups for those who have scoliosis. There are support groups for different age children, so they may talk to others who also have scoliosis. There are also support groups for parents of children who have scoliosis. Although I did not join a support group, I know many people find them helpful. Another coping mechanism is to stay physically active. It may be difficult for someone with scoliosis to play intense, compact sports, but there is so much more they can take part in. Yoga, stretching, walking a treadmill, and swimming are just a few ways to stay physically active. It is also very important to keep your weight at a healthy level. Being overweight or obese can cause more strain on one's back, which can make the curvatures worsen over time. I hope you have gained knowledge on the subject of scoliosis. It is important for parents and caregivers to be aware of the signs and symptoms of scoliosis. If someone in your care is diagnosed, you will now have more knowledge of the treatment and ways to help your loved one cope with the diagnosis of scoliosis. Anytime a loved one is diagnosed with a medical condition, it can be scary. Now, I hope with this knowledge, you can care for your loved one and help them through the diagnosis of scoliosis.